The Office of Inspector General, the U.S., which is under the U.S. Department of Health and Human Services, their April report was titled "Some Medicare Advantage Organization Denials of Prior Authorization Requests Raise Concerns About Beneficiary Access to Medically Necessary Care." And what's medically necessary should be deemed by your doctor, but that is not the case with Medicare Advantage because of prior authorization being a mechanism that the Medicare Advantage organizations are allowed to legally use. So that's what makes it very different than traditional or original Medicare. And so some of the key takeaways in this report, and I'll leave a link for it for you that are interested in knowing obviously your rights for your Medicare benefits, is that Medicare Advantage organizations denied prior authorization and payment requests that met Medicare coverage rules by using MAO, Medicare Advantage Organization clinical criteria that are not contained in Medicare coverage rules, requesting unnecessary documentation, so making you do more legwork, and making manual review errors and system errors. And so what the OIG found was alarming to them because it was a very, very small sample size in 2019. They tell you how they did the review in 2019 just for 1 week for the 15 of the largest Medicare Advantage organizations during June 1st through 7th, 2019, 500 denials via prior authorization. And prior authorization is typically done with your provider, your doctor, before you get your medical services, say treatments or procedures done, and before you go into the healthcare facilities or your doctor's office or wherever you need your care. And so if it's done in advance, a lot of times, you're gonna hope to that your prior authorization request won't be denied; it'll be approved, right? But here's what the OIG found about prior authorization requests. So you, as a Medicare beneficiary, having the right to request your medically necessary services from your providers that hopefully are in your network and can know, like, and trust for your health care. So we found that among the prior authorization requests that Medicare Advantage organizations, also known as MAOs, denied, 13% met Medicare coverage rules. That means the providers documented the actual service and was deeming them medically necessary. So in other words, these services likely would have been approved for these beneficiaries under original Medicare, also known as Medicare fee-for-service. And you can take a look at that right here in your Medicare and You handbook on page 5. And you clearly can see that there's two main paths to your Medicare coverage. And the original Medicare was designed in 1966 and is primary insurance. It's the largest, most robust primary insurance in the United States because of how many folks use it. So about 54% of the Medicare landscape beneficiary population, which is 64 million, have original Medicare as their primary insurance, and it doesn't have a network like Medicare Advantage or a service area like Medicare Advantage because it is the federal government. So it's primary insurance, and you can clearly see on page 5, you can use any doctor or hospital that takes Medicare anywhere in the U.S. And so there is no prior authorization. That's one of the biggest difference between original Medicare and Medicare Advantage. You don't need a referral to see the specialist in many instances for Medicare Advantage, especially if you have an HMO, local HMO. You're going to need to get a referral to see a specialist and just have a gatekeeper per se to get to other medical services that you may need. And so But when you have prior authorization in the mix, and it doesn't include that in the Medicare and You handbook, and it doesn't say that. So what I'm telling you about prior authorization is that you need to know about it before you enroll into a Medicare Advantage plan, because it's very important to you as a beneficiary, and it's very important, so important that the OIG did an April report about it with the denials of prior authorization requests. So please note that this is a very important video for you folks that are on Medicare Advantage, and it is definitely your right to know what's going on in the Medicare space, because it will benefit you if you are aware of the prior authorization requests. So they found that among the prior authorization requests denied, 13% met Medicare coverage rules, and like they said, these beneficiaries would have had those services under original Medicare, also known as FFS, fee for service. But they identified two common causes of these denials. First, MAOs use clinical criteria that are not contained in medical coverage rules, requiring an x-ray before approving more advanced imaging, which led them to deny requests for services that our physician reviewers determined were medically necessary. So they had their own physician reviewers, independent, and saying that they were medically necessary. Although our review determined that the requests in these cases did meet Medicare coverage rules, CMS guidance is not sufficient, is not significantly detailed to determine whether MAO may deny authorization based on internal MAO clinical criteria that go beyond Medicare coverage rules. So just note that, for you beneficiaries, there's more and more prior authorization requests. I always go and read the articles, recent articles, and even some Medicare Advantage organizations are even having prior authorization request denials for things like cataracts. So more an increase in that just as a policy. They're going to have a raise in prior authorization requests for something as common as cataracts. Okay, so for you providers out there, we found that among the payment requests that MAO denied, 18% met coverage rules, MAO billing rules, and most of these payment denials are in our sample were caused by human error during manual claims processing reviews. We all know that billing and coding is its own language, and sometimes very difficult to look into, even with all the software and data. So anyhow, if you're having as a provider 18% of your claims coming back from denials and not being paid for those medical services or supplies that you had in the claim, then obviously that can hurt your bottom line. So I'm going to go ahead and play the Medicare Advantage denials of care, and this was just only a few days ago. I'm doing this video May 11th, 2022, and this is what the Office of Inspector General at HHS YouTube channel had to say about Medicare Advantage denials of care. Here we go.
Medicare Advantage is the managed care option within the Medicare program. It's designed to provide efficient, high-quality care that improves patient health outcomes in a cost-efficient way. But a new report by the Department of Health and Human Services, Office of Inspector General, found that sometimes Medicare Advantage plans limited access to medically necessary services. To explain this report's findings, here is Rosemary Bartholomew.
In this report, we found that Medicare Advantage plans sometimes denied or delayed patients' access to care, even though the requests for services were medically necessary and met Medicare coverage rules. So in other words, the patients likely would have received approval if they had been enrolled in traditional Medicare rather than in Medicare Advantage.
These report findings are cause for concern for several reasons.
We have three main concerns about these denials for care that was medically necessary and that met Medicare coverage goals. First, these denials can cause delays or prevent patients from accessing needed health care. And that can be particularly harmful for patients who are critically ill and for whom any delay in care can cause negative health consequences. Second, these denials can cause some patients to pay out of pocket for services that are supposed to be covered by their Medicare benefits. And this can be particularly harmful for low-income patients and those who can't afford to pay for these services out of pocket. And third, these denials can cause an administrative burden for patients and providers who choose to appeal these denials. And even when denials are overturned upon appeal, we found that in some cases, going through the appeals process caused significant delays in patients' access to needed health care.
For more information, visit oig.hhs.gov/Medicare Advantage.
I hope that is enlightening to you guys that are currently on Medicare Advantage. You obviously know that your Medicare benefits are important to you. If you have questions or want to know more about the healthcare giants that are improperly denied Medicare benefits, then go to the next video, which is has the actual HHS OIG report on there, the video link right here. And we'd love to hear from you as well. If you have any questions for me, you can email me at mike@medicaresavings.us, or you can call me and drop a voicemail, because I get a lot of them, if you have experienced prior authorization and how it's affected your Medicare benefits. So it's very, very important to know when to shop your Medicare Advantage plan, whether it's the fall open enrollment, October 15th, October 15th through December 7th, or you can look to shop your plan in the very beginning of each and every year, known as Medicare Advantage open enrollment, January 1st to March 31st, unless you have a special enrollment period, which gives you the eligibility to enroll into another service area of Medicare Advantage, like you move out of the service area or you move out of the state or service area for your Medicare Advantage HMO or PPO. So if you have questions about that, please don't hesitate to email me or contact me. And if you want to know how to get in touch with our service here down in Charleston, South Carolina, please don't hesitate to reach out to us. So we have a few quick questions for you, so that way you can help us help you save some of your retirement dollars, especially if you're on traditional Medicare with a raising premium in your Medicare supplement or Medigap, or even your Part D. And if you have Medicare Advantage, again, you might want to look into something that is less restrictive if you're on an HMO and want to look towards more of a regional PPO. And if you just have general or specific Medicare benefits questions for your coverage, please let us know. Thank you so much for watching. If you do find these videos helpful, I would really appreciate not only getting your subscription, but also your comment as well. So please let me know if these videos are important to you. Thanks so much, and God bless.